MSF is sounding the alarm over a sharp rise in sexual violence. Since the M23 AFC forces took control of Goma in January 2025, MSF has recorded a surge in cases, treating nearly 10,000 survivors in just 4 months. The humanitarian organization says the situation remains dire, with health facilities overwhelmed and insecurity worsening across the region. To speak to us more about the ground realities, we're joined by Davina Hayles, who is MSF's Deputy Head of Programs in the Democratic Republic of Congo. Davina, thank you for joining us. How are you this Thursday?
Hello, good morning. Thank you very much. I'm doing well. Thank you.
We appreciate you making time for us on such a topic of importance. Since the M23 takeover in January, how has the security situation impacted MSF's ability to deliver medical care, particularly to survivors of sexual violence?
So we have not seen a decrease in the number of sexual violence and survivors in North Kivu, in Goma especially, since last year. So in 2024, we recorded around 40,000 cases. As you mentioned, in the first 4 months of this year, we've recorded 10,000 cases in Goma and Sake alone in MSF facilities. We're extremely worried and extremely concerned about the situation. The current insecurity in Goma and North Kivu is having an impact on access to healthcare for all the survivors of sexual violence in terms of accessing our services. We have around 20% of survivors that will reach our facilities in over 72 hours. As you know, it is critical for emergency care for sexual violence to arrive in a facility before 72 hours so that we can give the right treatment to prevent the risk of HIV, STDs as well.
What have you noticed in terms of patterns? Maybe if we look at the past 4 months, since we're zooming into that period of time, of sexual violence acts in the DRC?
So in 2024, we could see that most of the acts of sexual violence around Goma were when women and girls were going to the field to fetch wood, to go and collect food as well, or in their daily activities. As you know, in February this year, the IDP camps were dismantled when M23 came into Goma. So people moved away, some people returned, but many people to their original villages in North Kivu, but many people couldn't because they didn't have the means. And what we are seeing right now is that for a lot of the survivors, they're telling us that it's not only when they're going to the fields to collect wood or to collect food, or whilst they're in their daily activities, or for example, selling food and during the day, but now it's also at night. There's been increased insecurity this year in the center of Goma and in the outskirts of Goma. So what we're seeing is stories of survivors telling us that they're being attacked even in their homes. So it's not only by armed men with or without uniform, but also by people they know around them, because they do live in precarious situations. A lot of people haven't been able to go back home because maybe they have lost their home. There's nothing to go back to, so they're staying in Goma, or they don't have the money to go back. So extremely concerning.
Absolutely. As you say, you've recorded nearly 10,000 cases of sexual violence between January and April. But what are you noticing then in terms of these survivors, and after they've received medical care, what happens to them and what happens with them? And also the age groups that you are noticing are maybe even higher targeted. More targeted.
Yes, so we realize that actually it seems like nowhere is safe at the moment in North Kivu. We do have patients and survivors coming in from the age of 10 to the age of 70. It feels like it's not only during the day, but also in the evening that they're being attacked at the moment, being violated. So for us as MSF, we do emergency response. So we do both the medical treatment and mental health treatment. We are worried that we are the only organization at the moment that has the PEP kits, which is the post-exposure prophylaxis, that will prevent STDs and also has emergency contraceptive care here in Goma and in North Kivu overall.
How are MSF teams coping with the overwhelming number of cases, and what additional resources are urgently needed on the ground? We imagine you are also traumatized.
Yes, so at the moment what we can see is that with the aid cuts in the aid sector globally have had a massive impact in North Kivu. It has had a massive impact in terms of the number of organizations having the capacity to treat survivors of sexual violence. We have seen that there's not enough PEP kits. The USAID cuts have meant that around 10,000 kits for medication to prevent STDs and HIV have not arrived in Goma. So what we would ask for is for the international community to step up in terms of the funding and the assistance they are giving.
Using the digital space and telecommunication space, how possible is that at this stage in terms of giving support to the already support that you have in terms of counseling services and physical medical services? Is that something that could be possible to do things like telephonic counseling or online counseling should some survivors not be able to reach physical facilities?
So at the moment, we have facilities in Goma, in other areas in North Kivu. We have programming, so in Ruchuru, in Binza, in Bamboo, in Kibirizi, and in Masisi. We can see that a lot of the women that are coming to our facilities in Goma are walking quite a few kilometers to be able to reach our facilities. We are trying to provide the best emergency medical and mental health care. We have around 1,300 mental health consultations in our facilities in Goma and Sake per month. So at the moment, this is what is being provided. We know that the services are for free, so that's why we know that a lot of survivors are coming to us and they do have access. In terms of digital modes of mental health care that we could provide, we could explore this for the future as well.
In terms of the uptake of volunteers, how are things looking on that front for MSF within the DRC?
So for MSF in DRC, we have our teams on the ground. We work with the Ministry of Public Health in providing these services in primary healthcare centers. We also work on community engagement and health promotion with all the community engagement officers, women and men, that work with these health facilities. So we have a large network.
What message do you have for the international community regarding the ongoing crisis? I mean, as it looks, it's nowhere near the end. But also the protection of civilians, especially women and girls in the eastern DRC.
So, as I said, we are very, very worried about the current situation of sexual violence in eastern DRC. We know that the continued fighting and insecurity across the whole region in northern Kivu is having an impact on access to health facilities and emergency healthcare for survivors of sexual violence. And we're very worried about this. So we do ask also the international community and international donors to step up in terms of the financing for or international organizations here so that they can provide the appropriate care.
All right. Well, thank you so much, Davina. We'll leave it there for today. And we take our hats off to the work that the MSF is doing there in the DRC, Eastern DRC specifically. So thank you for giving us some insight into this topic.
Thank you very much. And thank you for giving me the space and opportunity to talk about it.
Our pleasure.